This video is related to the importance of good oral health for Missourians with intellectual and developmental disabilities. Our goal is to increase awareness of the relationship between oral health and general health and to give you the knowledge of how to achieve good oral health and hygiene. These videos were made possible by the Dental Trade Alliance Foundation.
So some of our consumers are visually impaired and some of them are hearing impaired. So I recommend always doing what I call a tell, show, do method. So you'll tell the consumer what we're going to do and then show them, use a toothbrush or a gesture, and then go ahead and provide the care. What that will do is it will decrease anxiety and increase participation with the consumer. So we always want to make sure that we're brushing our consumers' teeth at least once a day. So sometimes we have a resistant consumer. This could be because of some trauma or they're just not used to having toothbrushing done. So I will always recommend at least attempting toothbrushing, even if you're not completely successful. So if that means you're just taking a consumer into the bathroom and showing them the toothbrush and showing them the toothpaste and familiarizing them, then that's what we do that day. And you just make sure it's consistent every single day. And slowly you'll start to desensitize them to the environment and have a better ability for successful oral care in the future. Some of our consumers are more resistant than others. So something that you can try is, have the toothbrush with the toothpaste and everything ready. Attempt to brush their teeth. If they say no, refuse to open their mouth, or resist in any way, you can stop. Remind them what we're trying to do. Hey, we're trying to brush your teeth right now, so that way you can have good breath for the rest of the day, so that they don't get overwhelmed. It can reinforce a negative experience with toothbrushing, and we don't want to do that. So I would say just try twice. Try once, give them a break, and then try again. You can also do that with different tools. So once with the toothbrush, they say no. Try again with the toothbrush, they say no, put the toothbrush down. And then you can pick up a swab. You try once with the swab, they say no, explain to them what's going on, try the swab again, and then if they say no, then you move on to the mouthwash. And then you do that, and it helps desensitize them. But you also don't want to spend too much time in the bathroom, because that could become a negative experience for them as well. So make sure you use a toothbrush with every single consumer. Even if the consumer doesn't have teeth, you can still brush their tongue and their cheeks with a toothbrush. And then use a swab for the gums. The gums are a lot softer, so I don't recommend using a toothbrush for the gums, but you can use it for the tongue and for the cheeks. And then if we have someone who is NPO or they take tube feedings, then I would also recommend still using a toothbrush. However, you may not use toothpaste on them. So when we're working with NPO consumers or someone who takes nutrition by tube feedings and doesn't take any food by mouth, what I recommend is you take a small medicine cup and you just put a tiny bit of mouthwash in it. And you'll take your toothbrush, dip it into the mouthwash, shake the toothbrush off. Essentially, you just want a minty flavored toothbrush at that point. Brush their mouth, their tongue, their cheeks, their teeth. And then you'll take an oral swab with nothing on it, no water, no mouthwash, and you'll swab the mouth. You use this more of as a sponge. Our consumers, they aren't used to having anything in their mouth, so they may have excess saliva production. And you'll use that sponge to soak up any saliva, any mouthwash that may have not been shaken off, and then also any blood that could be on there.
Check out our other videos on the relationship between oral and general health and how to assist someone with oral hygiene.